Hi, this is Dr. Greg Oliver, Fat Doctor TV. Today we're going to talk about the third component of our health. We talked about the physical nature of our health. We've talked about the mental nature of our health. And today we're going to talk about the emotional nature of our health. When it comes to weight loss, to getting lean, to getting healthy, to taking better care of our body, there are a lot of emotions that are involved in that. Some people decide right away that it's not worth the struggle, that they have a deep-seated emotional issue with failure, so they never get started in the right path. Maybe they sign up at the gym and they never go, or they sign up at a health club and they never go, or they make an appointment to see their doctor and they just don't show up. They have a deep-seated emotional fear of failing, so they never get started. Other people, it has more to do with the emotions of eating. Let me tell you that I have patients who consistently will eat when they're lonely, eat when they're sad. Even we know that people get happy and they associate it with, hey, let's go out to the restaurant or the bar, and they overeat. So our emotions will drive eating in many, many circumstances. Certainly sadness and loneliness and break up from relationships. A lot of people will sit at home and eat certain types of foods. We know that chocolate and high fatty food or foods that are extremely high in carbohydrate content kind of increase the dopamine in our brain. Dopamine is that feel-good hormone or feel-good chemical actually that we have, and when we eat certain foods it increases the level of dopamine. We also think that if we eat too many of those foods on a regular basis, we may stimulate that dopamine enough that it gives us kind of a mini addiction cycle. A lot of drug addicts will use medications and drugs to get a dopamine high. And so we know that certain foods, especially the carbohydrates and things like chocolate, can raise our dopamine levels. So our emotions play a tremendous role in our ability to lose weight. Now, can you change your emotions? Not overnight, but you can on an ongoing basis. You can learn different techniques to satisfy your emotions. So when you're sad or you're lonely, we have to get to the point where we realize that food is not going to make those things go away. And if it does, it's only a short-term or temporary effect. We have to find other ways to deal with it. That could be counseling. That could be seeing your doctor. That could be having a good support group, whether it's your friends or a church group. Lots of different ways to deal with loneliness, with sadness, with depression. Maybe you need to see a physician and get treated for those things. So there's lots of different ways to do it. The other thing is when we're in an elation state or a state of feeling really good, we've done something really exciting, if we can avoid having food at that time, then we eliminate those anchors, and so food shouldn't become an anchor to everything we do. I have friends and people I know that we always say, hey, when you get together, it's always around food. Well, try to get together for other things that are not food related. Get together for a sporting event without the food. Get together, just sit on the back porch and talk and have a good time, enjoy each other's company without the food. So if we can take the food out of the emotional equation, then we'll certainly have less problems trying to lose the weight and get healthy. So think about your emotions next time you're eating. Am I in a highly emotional state? If I am, stay away from the cupboard, stay away from the refrigerator. Find another way to deal with that highly emotional state, whether it's a very positive emotional state or a very negative emotional state. Try not to add food in the equation because the brain will learn that process, and biochemically, once that learning behavior has taken place, it can become almost like a food addiction. So watch the emotions, stay on the positive side if you can, and if you're having trouble with emotions, make sure and see a professional about that. That might be a doctor, a therapist, a counselor, a psychologist, or someone who's a good friend who can just work with you on that, okay? Take care. We'll see you next time on Fat Doctor TV, and have a happy day. Talk to you later.